When we think about human capital, broadly, economists talk about three areas of human capital. One is education, one is health, and the third is the ability to relocate for a job, which we broadly call migration. And so health is a type of human capital that we can invest in as individuals, families, and society.
The coronavirus pandemic has created an increased awareness of health. Because we all have a different definition of what it means to live a healthy life, a group of Kansas State University specialists have rebooted a blog called Health Means to help people figure out the best way to live more healthfully and, in turn, improve the health of their families and community. On today's Sound Living, what does health mean to you? Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. K-State Research and Extension Nutrition Specialist Sandy Procter and Extension Family Resource Management Specialist Elizabeth Kish are both contributors and editors for the Health Means blog. Elizabeth, the Health and Human Sciences Specialist, have resurrected and really expanding on a blog that you started, I think, probably a couple of years ago that really dealt with all aspects of what goes on through Extension.
That's right. We started a blog a few years ago called Health Means, and the idea was that we intended to be a conversation about health and well-being. And we, as content specialists within the College of Health and Human Sciences, really touch on so many aspects of health and well-being, and we wanted to talk about that because health is so much more than the absence of disease or illness.
You have a number of contributors to this, and you're doing it every couple of weeks.
That's right. The contributors are the content specialists, the faculty members in the College of Health and Human Sciences with extension appointments. We may expand that further as we go along. So we're covering child development, family life, youth development, adult development and aging, family finances, healthy eating and active living, community health and health policy. What else, Sandy?
Well, I think you've touched on just about everything, but we've rolled into that so much of the current events around health as well. So many of those have either a policy basis or an effect on policy and practice to come that it seems to have taken a real right now frame as well.
I think everybody's really tuned into their health right now because of the pandemic, and as part of that, it gives you an opportunity to kind of hit home on some of those messages that you've been talking about all through the year.
That's right. I think one of the other goals is we really do want to talk about the research base, the evidence base, the science of what we do and how it relates to health.
And I do think it's a really good opportunity for Extension to get some of those important messages out that really are a big part of the conversation, or ought to be, but maybe don't actually stand alone. But yet they're part of the ongoing education that we do and we need to do. The messaging around how important it is to at least be aware of, if you choose to be vaccinated, how important that can be to your community, to your family, to those beyond you, and really to talk about some of that further reaching sort of consideration that might not be as readily apparent, but we know is supported by the research.
So another aspect of that might be that we don't necessarily think of intuitively as an element of health is thinking about affordable early child care and how that can really benefit families, communities, and most importantly, the children that are in quality care as youngsters.
And just from a nutrition aspect, the ability to know that your child is being well fed and offered healthy foods throughout the day really allows parents to really focus on their work and be quality employees when maybe that distraction might just, make it just that much more stressful if that child care weren't available. It's a really important part of what we consider holistic and complete health in a community.
And Elizabeth, from your standpoint, when we talk about family finances, we often talk about the health of our finances, but as we've talked about in the past, really that financial situation also crosses over into your health as well.
It really does. And it happens in more than one way. We can think about the products and services that we include in our budgets our spending plans that are related to health. For example, health insurance, if we have prescription medications, when we go to the doctor or other healthcare providers, those are all expenses that we have. But then there are also other choices that we might make with our resources that can impact our health in other ways. Some of that is risk management. That can include even things like, wearing seatbelts, or back to, and I'll let Sandy talk more about this, but the foods that we choose to eat, all of these things are resources that we have. And in fact, when we think about human capital broadly, economists talk about 3 areas of human capital. One is education, one is health, and the third is the ability to relocate for a job, which we broadly call migration. And so health is a type of human capital that we can invest in as individuals, families, and society.
She touched on it, Sandy. One of the most important decisions we make towards our health is the food we choose to eat and how active we are.
Yeah, we've talked about this before, that in some ways I always consider that sort of the center of everything. It starts with that concentric circle sort of thing. The individual is in the middle. And when attention and care is given to that, health means, the individual health, but it also means then expanding that ability to feed your family, having access to food. And that's one of my early visions around this blog, was that health means the access to what we need to be healthy, whether that's healthy food or health care or resources like parks and ability to have outside exercise and safe walkways and all those things that may not seem like health. The infrastructure may not seem like health in the first glance, but are so important to supporting our health.
We often talk about, from the financial side, Elizabeth, starting early and saving early to build your wealth, but that also applies to our health as well. When we start young and we're healthy from the get-go, we age better and our life is probably better.
That's right. That's one way that health and finances are similar, in that most of the time problems develop over time, or challenges develop over time. An example that sometimes we give is with debt, right? You don't usually start out with a large amount of debt. When you get your first credit card, your limit is quite low relatively. And if you do well with that, then they continue to raise it. And then suddenly you might realize, oh my gosh, I have all this credit card debt and I don't know what to do about it. And sometimes the same thing can happen with our health, possibly in terms of weight gain if we're not active or we're not watching our weight, but other ways too. If we don't get our annual checkups, if we don't do our recommended screenings and we delay them, then what might have been caught early and could have been addressed when it was less severe sometimes then develops into something more severe.
That is so true, and especially around some of the science that's coming out now around the fetal origins of adult onset diseases. We know that healthy moms and healthy babies and access to food throughout life can really, truly be shown to prevent or lessen the effect of the onset of chronic diseases such as type 2 diabetes, you mentioned obesity, so many of the, even heart disease, so many of the chronic diseases that we face as adults are being found to be really related to the quality and that early onset of investment in, the old saying of food as medicine, and all of that takes the resources, not just the food, but the access and the financial ability to get that. And so all of these factors interplay, and none can be taken away as we're building health.
I know that both of you are contributing to the blog, so kind of walk me through this. How does it work in terms of the ideas that you come up with, and how is it structured? How can people participate? How can they get the information, that kind of thing?
It's structured that we post new content every other week, about 2 times a month. It's really up to our co-contributors based on our individual content expertise. The other connection that we're trying to make with each post is something called Healthy People 2030, and that is a framework for health for people in the United States, goals that emphasize these central ideas and functions of what it means to be healthy. And so the vision of the Healthy People 2030 framework is that we live in a society in which all people can achieve their full potential for health and well-being across the lifespan. And as I think we've given many examples of how our content actually within K-State Research and Extension actually can contribute to that vision. So each of our posts, then, we try to tie them back, or so far we've been successful in tying them back to one of the Healthy People 2030 objectives. We sort of end each post by saying health means something. For example, the most recent post we had was on social determinants of health. So the way we ended it is that health means increasing the proportion of children living with at least one employed parent year-round, full-time. We wanted to show how what we do contributes to the larger conversations happening within our country about health, and also to show that what we do, even though most of us don't have a title of health in our job titles, what our content really does is contribute to health.
And as you were talking, Elizabeth, I was thinking one of our next upcoming blogs is so important in the regard that you mentioned, sort of tying it all together and really addressing that umbrella of mental health. And Brad Dirks has contributed to this series in a really nice way, talking about how important mental health is to all of the rest of what we do and try to do as individuals and as communities, and how looking at the aspect of mental health is something that instead of turning away or shying away, we need to really look face on and make sure that we are contributing the resources and the attention that the subject deserves anytime, but especially now. And I think his upcoming blog is going to be one that people will really enjoy reading and considering, because it really takes on that overarching angle of health.
This is maybe beyond just information. This is also encouraging people to kind of think about their health.
Yes, I think the scale of it is going to kind of expand people's mindsets, I hope, about what they can do about their personal health and how their personal health affects the health of their community's success, the well-being of their entire family. It's not just an individual thing. Obviously, it's not with money or with food access. But if there is a mental health concern, it reaches way more than the individual that it might be affecting. And so taking a look at and considering the reach of health aspects, I think, is one of the hopes that we have for this, that people will spend some time really considering how far-reaching health is and how important it is to at least be aware and try to do whatever is possible to improve it.
Really a good time for this reboot, though, because I think the pandemic has brought the aspect that we need to think about things as a community. We need to do things as a community because it's so much more effective when we take that approach.
I would agree with that, because what we know from the pandemic is that the actions that I take can protect you, the actions that you take can protect me. And while we as Americans revere this idea of rugged individualism, sometimes we cannot act as rugged individuals. That's not enough. We have to act as members of a community. I think the other thing, back to the idea of really challenging readers, or we hope readers will challenge themselves to think about what health means for them. So one of the things that we do when we introduce our contributors is we ask them, for example, what does health mean in one word to you? And it means something different to all of us. And I think, when we think about achieving goals or setting goals and then achieving them, they often start with dreams or visions for the future. So if we can get clear for ourselves, what does our personal health look like, all the different facets of that, and how can we then talk about it, I think we can start to achieve that for ourselves.
That's K-State Research and Extension Family Resource Management Specialist Elizabeth Kish and Extension Nutrition Specialist Sandy Procter. To read or subscribe to the blog, go to blogs.k-state.edu/healthmeans. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.